Sonoma County's health officer, and I'm here to share the latest updates on coronavirus with you. As of yesterday, July 28th, we have 2,662 cases, 1,194 are active, and 1,437 have recovered. We now have 31 deaths, an increase of 7 in the last 24 hours. We've done almost 75,000 coronavirus tests to date, with 3,305 of those tests in the last 24 hours. The rate of positive cases is 6%, which reflects a 7-day average ending July 21st. Our case rate is now 136.3 per 100,000, 36.3 above the state's threshold. So today, before we begin, I'd really like to talk about the recent deaths reported yesterday from COVID-19. 7 more deaths tied to COVID-19 have been reported, all of them over the age of 65 with underlying health conditions and all from skilled nursing facilities. We offer our condolences and our hearts go out to the families. I have great empathy for these families that are dealing with their seniors that are in the situation of being in these very vulnerable facilities. These deaths are a heartbreaking reminder of just how devastating this disease is for the most vulnerable residents in our community and in our county. We're working with the skilled nursing facilities and the state of California to identify a site to designate as a site for local skilled nursing facility residents who are infected with COVID to isolate and quarantine if they are contacts. The goal really is to separate those who have the virus from those who don't. And this is, as you know, an issue that's been going on all over the state of California in different counties. Today, I want to share with you that although COVID-19, this pandemic is challenging our community at so many levels, together we can face these difficulties and emerge even stronger. As you know, Sonoma County was placed on the state's monitoring list because our COVID-19 data showed that we met the thresholds or were above the thresholds allowed. Key metrics that then would allow businesses and public spaces to open up and remain open once we are under those thresholds. This meant that we had to temporarily stop indoor dining and drinking at restaurants, brew pubs, wineries, and close down other indoor operations, salons, gyms, as well as other activities that serve a large number of people in closed spaces. The state mandated these rollbacks 2 weeks ago when we joined many other counties in California on the monitoring or watch list. We'll remain on the list for at least 3 weeks as we work closely with California State Department of Public Health to implement actions to improve our numbers so that we can reopen. The key indicators that prompted our county's placement on the monitoring list were elevated disease transmission, that is the case rate per 100,000, and limited hospital capacity. In other words, a decrease in the percentage of available ICU beds, and also an increase in percentage of hospitalizations. A recent article described local hospitals as being hammered, quote unquote, by a spike in cases, with 46 patients being treated in hospitals over this past weekend. Outbreaks in 16 of the 20 skilled nursing facilities is driving the surge in hospitalizations and contributing to the deaths. Workplace transmission and increased social gatherings are also driving up the infection rate. For now, no further restrictions are planned, but if we can't get below 100 cases per 100,000 people, we will continue with the restrictions that are in place now. We know that only by taking decisive individual and collective action against COVID will we be able to reopen the doors of recently closed businesses and continue lifting these state-mandated restrictions. We all want Sonoma County to flourish. And part of what makes our county great are our distinctive and diverse local businesses that we depend on. So we really want to move towards reopening these businesses and other activities. Here's what you can do in your part to decrease COVID-19 cases. You could limit your social circle to members of your household only. Avoid gatherings of non-household members. Wash your hands often for 20 seconds at a time. Wear a face covering when outside your home. especially when in indoor settings, even if you can physically distance 6 feet from others. If you feel sick, stay at home. And if you feel really sick, then call your doctor so that you can be tested for COVID. If you learn that you're exposed to someone with COVID-19, contact your healthcare provider and get guidance on getting tested and find out what you need to do in terms of quarantine. Remember, we are in this together. Even if you're not worried about getting sick, protect those around you by practicing physical distancing, wearing a facial covering, and washing your hands, and following other general hygiene measures. And with that being said, I do have a community question to answer. The question is, what do you think of the Healdsburg plan to close the street so businesses can expand onto the sidewalk? The Healdsburg initiative to close the streets around the plaza can work if business owners and residents work together to limit the spread of COVID-19 by following protocols, physical distancing, wearing face coverings, and washing hands with hand sanitizer. I appreciate the creativity that cities like Healdsburg are employing and the community working together to build solutions to the challenges of COVID-19. So have a great day, and we will talk again soon.